Hi, I'm Dr. Soto, and I am here at Endodontics Associates, and I get a lot of questions about what is an endodontist. So here I am to answer those for you. An endodontist, well, very simple. We get confused all the time with an endocrinologist, but we are not endocrinologists. That's physician side. We are the dentist that specializes in the inside of the tooth or the nerve or the pulp, which is the scientific term. We do root canals. So endodontics, we are the dentist that specializes in root canals. Your dentist refer you to an endodontist because many reasons. Number one, we have the technology and the advanced equipment to do your root canal. Some teeth have different anatomies, very complicated curves, roots, you name it. And we are equipped to treat those. Number one, we have CT scans in our practices. We have microscopes because we have to work on those little bitty canals in there, and we need big magnification in order to see them. We also have special tools to help you get number. We're the expert in bacteria. That's who we are combating. So we definitely know how to handle it. Ultimately, we are here to save your tooth. What is the difference between an endodontist and a general dentist? Well, a general dentist is the cheerleader actually of the whole team. The general dentist is equipped to do more general items in dentistry, but when things get a little bit more complicated or above their standard of care, they will refer out, as they will refer to for the wisdom teeth extraction to an oral surgeon. They will refer to an endodontist for complicated root canal treatments. General dentists are here to do root canals. Usually 75% of the root canals done in the US, based on a research done by the AAE, are done by the general dentist. They are our friends. There's not enough endodontics in the US for us to treat all the root canals that come our way. So with that said, we team up with them and we support them on those complicated cases that need really extra special care. What procedures are done in endodontics? Well, number one, regular root canal treatments. We also do a procedure called retreatment, where a root canal needs to be retouched or redone because now there's bacteria involved in there, or a fracture, or something that really has caused that root canal to be reinfected. The third procedure that we do are microsurgery or root canal surgery. Probably you know it too, where we use the word apical ectomies. Well, that is a big blanket for endodontic surgery, meaning, for example, a root canal that we really cannot fix through the tooth, then we'll go from the outside. We do a small little incision, we get into those roots, fix the problem, get rid of the infection. If we have to get rid of a root that is fractured and keep the rest intact in there so you can function, that's what we do. It's like when you buy an apple and the apple has a bad part in there, do you throw the whole apple away? No, you cut the bad part and then you eat the rest. So that's exactly what we do when we do endodontic surgery. How does an endodontist determines if you need a root canal? Well, we do testing. We don't take the word just for the x-ray, right? We go ahead and then it's a conglomerate of different things. We test the tooth for temperature. We either do cold test or heat test. We also test the tooth for pressure. We touch it with our finger, or we just touch it with an instrument, kind of give a little tap in there to see how you perceive or feel that sensation, or we just put a little Q-tip and have you bite and grind together your teeth and see how you gauge that pressure. Always comparing with the tooth in front and the tooth behind. So that way you know and we know where exactly this discomfort is coming from. We also do mobility testing, which we are going to check and see how that tooth moves in your mouth. Some teeth get so infected and so inflamed that they're just dancing a mambo there. So we really want to check on that. And not only that, we want to do the right tooth, right? You want us to do the right tooth. We need all these tests. It's a combination of things, including the x-rays. I think that most of us, what we do is the x-rays is the last part, so we can put everything together and then come up with a diagnosis or with a result on what are we going to do and what do you need. If you need anything at all. Sometimes we get cases that they think that they need a root canal and actually they've been clenching or biting all night long and the teeth are hurting. They don't need anything. We will not proceed with any treatment unless you are diagnosed correctly. Does insurance covers endodontic procedures? Yes. And the answer is depending on your insurance or your policy. Some insurances cover them 80%, some covers them 50%, some cover them 100%. Also depends on how the endodontic procedure or the root canal procedure is classified. If it's classified as basic or if it's classified as major. Some insurances put stipulations if they're classified as major. Then you might have to wait a year if this is a brand new insurance in order for you to get this procedure paid. Some insurances don't cover them at all. We know that because we are heavily contracted with insurances. We are experts in insurance and we know how to handle them to get the best out of what you're paying for. The contract with the insurance is with you. We are like the third party and or the servicing provider, and we definitely are going to fight for your rights, right? But we also need you in our team to help us get the information that we need in order to maximize your benefits. I hope I was able to answer some of your questions. I'm here to help. If you have any questions, please feel free to call us at 770-499-2102. We have 4 locations: Atlanta, Cartersville, Roswell, and Kennesaw, and we are definitely here to help. Excited to just get on this journey. If you need a root canal or not, we are here to help. Just call us.